Well, hello there once again to everyone out there. This is Travis James Zipper with In3 Nutrition and the Nutritional Coaching Institute. And today, we are going to go over one of my favorite functional medicine tests, the Dutch test. Now, the Dutch test stands for Dried Urine Test for Comprehensive Hormones, and it's what I believe to be the newest and best hormonal test on the market today. The reasons why are what we are going to discuss here today, as well as how it can be such a great tool for anyone attempting to really interpret what's going on with themselves hormonally or with their clients hormonally. So I mentioned the Dutch test is a urine test. And when you hear that, you might ask, how is this test different from a saliva test or a simple blood draw test? Well, to start, the Dutch test is super simple. It involves urinating on 4 to 5 strips of filter paper throughout the day, and saliva swabs are used for the cortisol portion. And that's a nice little bonus, as most saliva tests require you to generate a whole bunch of saliva. And believe it or not, that can be hard to do for some people. So from those 5 to easy collect strips and saliva swabs, you will get a whole bunch of information that includes your diurnal cortisol pattern and your cortisol awakening response. Diurnal is the pattern that it goes throughout the day. It will also report your free cortisol and free cortisone levels. Remember, cortisone is the deactivated portion of cortisol. It's going to show your metabolized cortisol, which represents over 80% of the body's cortisol production each day. And it will also give you detailed information on testosterone and DHEA and the pathways that those hormones go down, as well as super great information on all 3 estrogens and how the body metabolizes those estrogens, which is super important. There's also a couple great extras that it gives. It gives a marker called 8-OHDG, which is the body's main oxidative stress marker, as well as it checks for melatonin, which if it's high or low, can possibly signify gut problems. And then just a new recent addition to the Dutch test is they're now giving organic acids. They give you 6 of them, which can show possible nutrient deficiencies or neurotransmitter deficiencies. So the next question is, who is going to benefit the most from the Dutch test? And I guess when it comes to women, situations or conditions that women have or are experiencing might include fatigue, PMS, fertility issues, PCOS, hair loss, acne, mood swings, weight gain. And in men, the test would be better suited for those who are suffering from issues with fatigue, mood swings, low motivation, hair loss, erectile deficient issues, and lastly, fertility. The Dutch test is also great if you wanted to compare a person's baseline hormone levels, to comparing it to if they were taking any form of hormone replacement, or if they wanted to see how their body is processing those certain hormones that they're taking. For example, in the case of testosterone, is the body processing it down the less symptomatic beta pathway or the more symptomatic alpha pathway? That's something that's super important to know when it comes to diagnosing why are certain symptoms coming up. The Dutch test, it does have a few rules. It's a little more difficult than a standard blood test when it comes to the collection process. And this process needs to be followed or won't really give a true indication of what is going on in the body. And this really only applies to testing hormones on premenopausal or regularly cycling women. And in that situation of a regularly cycling woman, the test needs to be taken on days 19, 20, or 21 of a 28-day cycle. And there's ways that you can figure that out. Also, if the female is on oral birth control, any form besides the copper IUD, the test will not show accurate readings. So maybe you might want to only go with the adrenal portion of the test for that particular female. Now, the reason why the test is collected on days 19 through 22 is that we want to see the peaks of both estrogen and progesterone so we can see if ovulation has occurred. Pretty important to see, and that's why you always, even in blood tests, you want to get tested around that same time. So when again we will use the Dutch test, some of the best examples for women why they might want to use the Dutch test: PMS, PCOS, irregular cycles, fertility issues, perimenopausal or menopausal symptoms. When it comes to overall general examples, people who might be dealing with thyroid issues, adrenal issues such as adrenal fatigue or the proper term HPA axis dysfunction, people who suffer from insomnia, extreme stress, symptoms upon waking up, and those who are suffering from obesity or weight loss resistance, and then lastly, those who are having mood symptoms. Now, getting into the specifics of the Dutch test, on page 1, and this is what page 1 looks like, it gives a basic overview of progesterone, estrogen, the androgens, cortisol, and then on page 2, it goes into more detail regarding all the hormones' metabolites and how the body is processing all of those hormones. For example, it shows 5-alpha DHT and 5-alpha reductase activity, a symptom of testosterone. And it's measuring pretty much how the body is utilizing the testosterone, which can signify if certain symptoms are popping up and why. Now, the information on page 5, it details more information about the cortisol waking response if that portion of the test is ordered. Otherwise, it just details regular cortisol output and how the body is using that cortisol, and lastly, cortisone and melatonin production. We'll go through each one of these a little bit more. Now, on page 3, on this section right here, higher androgens in females that tend to favor that 5-alpha pathway that I discussed can have more androgenic side effects, such as hair loss or hair growth, acne, or mood swings. Typical symptoms from excessive testosterone, but it also makes a big difference as to which way they're processing it. Whereas males who have that 5-alpha preference for the androgens can suffer from symptoms such as male pattern baldness, mood swings, and lastly, prostate issues. Some of the more important facts that when it comes to sex hormones is that the Dutch test, you can get a great idea as if there are any imbalances when it comes to estrogen and progesterone, and how the body is clearing out those estrogen metabolites called 16-OH, 4-OH, and 2-OH. As 2-OH is the good and healthy estrogen metabolite, the one all the way down at the bottom, and 4-OH is the possible cancer-causing metabolite, where 16-OH is right in the middle, meaning that you don't want to have it too high and you don't want to have it too low. Now, by looking at page 3 of the Dutch test, you can get a great feel for how the body is actually getting rid of estrogen in what is called phase 1 and phase 2 detoxification. As a person can be estrogen dominant in phase 1 or estrogen dominant in phase 2 or even in both phases. Now, this is shown by these 3 stages on page 3 on the right-hand side. So pretty much phase 1 and phase 2 right here with those metabolites that I just mentioned. Now, if you are new to the hormonal game, you might still be asking yourself, really, what is estrogen metabolism and why is it so important? Well, to start, if there is an estrogen dominance or low levels of progesterone to estrogen, the patient could be exhibiting symptoms that will clearly be explained by this test, and will give you a clear indication showing of exactly what's going on and why. And next, depending on the patient or the client, if they're male or female, and their symptoms and the situation, it can be addressed accordingly based on if they're having a phase 1 or a phase 2 or issues with both. And then you can possibly create a food and supplement plan that can address those specific problems instead of just shooting right there in the dark, which you would do from possibly just a blood test. For example, phase 1 treatment for a person could include supplementing with supplements such as DIM or In3-carbinol. Or if phase 2 was the only problem, then you could supplement with something like SAMe, P5P, magnesium, choline, methionine, all your methylated B vitamins, and then trimethylglycine, also known as TMG. For overall general liver support, a person could add in some calcium D-glucarate or glutathione, or even NAC, because that's the precursor to glutathione, as well as getting in as many detox-friendly foods as possible, such as broccoli and kale and Brussels sprouts, broccoli sprouts, artichokes, onions, and then foods high in fiber and some fermented foods could also be of huge benefit. You could get all of that catered plan by looking at how they're detoxifying and processing those estrogens. Now, there are 2 versions of the Dutch test, the Dutch Complete and the Dutch Plus. The main difference between the 2 is that the Dutch Plus is really superior to the Dutch Complete when it comes to measuring a person's cortisol output. As Precision Analytical, the lab that created the Dutch test, says that if a person wants to generally know more about their hormone adrenal situation, or if insomnia is like one of the main issues, then the Dutch Complete is going to be a perfect option for them. But if a person is having more issues with regards to the morning time or having a hard time getting going, or if they suffer from any type of anxiety, panic, or fatigue, then the Dutch Plus with the cortisol awakening response, or CORE, is the advised test. Personally, I think the Plus with the CAR, the cortisol awakening response, is a useful piece of information for each and every person, and definitely worth the extra couple bucks. So I mentioned the cortisol awakening response. You might be asking, what is that? Well, the cortisol awakening response is kind of like a mini stress test of the hypothalamus pituitary adrenal axis, also known as the HPA axis. Now, if a person has a low or depressed cortisol awakening response, then that means that they usually are going to have a hard time getting up and getting going in the morning, which can also mean that they're probably suffering from HPA axis dysfunction or possibly be adrenally deficient. Now, while we're talking about cortisol, another super important feature that the Dutch test offers is that it measures the body's metabolized cortisol just like it measures the metabolized androgens and estrogens. You might be asking yourself, what's so important about metabolized cortisol? I understand maybe estrogen and testosterone, but the easiest way to explain things with metabolized cortisol actually shows how much cortisol the body actually uses each day, which is super important. So this is the graph on the Dutch test that shows how much cortisol that the body cranks out each day. And it's usually located on page 1 of the test. The goal of reading all of the dials on the Dutch test is that you want the arrow, this yellow arrow or green arrow, to be between the 2 yellow stars that represents the upper and lower reference range for that particular hormone. There are unfortunately thousands of patients who get tested for cortisol readings through saliva and have a low total cortisol, and they don't show the metabolized cortisol. And what happens is when their metabolized cortisol does not get tested, then people or practitioners are going to treat people for adrenal fatigue when they really don't know how much cortisol that person is burning through. Now, this occurs because when someone only considers those 4 or 5 snapshots that you take in those samples that you spit into the tubes throughout the day, again, those are snapshots of about a 15 to 30 minute period of cortisol production for that time. And it does not consider the actual metabolism of the cortisol and how much your body's producing each day. And because of that, a possible false diagnosis can occur, and it does happen all the time. Because remember, the overall cortisol production could be fine, but a low reading could just be occurring because when those 4 or 5 snapshots were taken, the person could have just happened to have a low output at that time. Meaning that there's really not a true deficiency if you don't take in both into consideration. What it would mean is if someone just had a low cortisol and a high metabolized, what that means is the body is just burning through it at a super fast pace. What that would look like is this. So you see you have the total cortisol, okay, which are the snapshots, and then you have the metabolized. Both of those are low. That would be an accurate adrenally deficient diagnosis. And that's what it would look like on the Dutch test. So something important to really know is that if you're just getting the snapshots, you're not getting the whole picture. Where if someone was truly running low on cortisol, they would feel it, and you should get the test results to back it up. So once you have the Dutch test and interpret both the total and metabolized cortisol, meaning you know how much cortisol a person is producing and how much they are actually burning through, what can that information tell you? Well, it can tell you if a person is possibly experiencing long-term stress, okay, not acute, inflammation, infection, pain, obesity, insulin dysregulation or resistance, hyperthyroidism, could be too much medications or too many supplements. Now, in reverse of that, if a person were to have low total cortisol, or the snapshot versions as well as the low metabolized cortisol clearance, just like the graph I just showed you on the previous page, it could point to problems such as hypothyroid situations, or not enough medications or supplements if they're on it, HPA miscommunication, corticosteroid use, like oral or injected, topical, things like prednisone. They could be on too high a dose of opioid pain medications, like codeine or morphine or hydrocodone. They could be taking Accutane. They could be suffering from anorexia. They could have like a traumatic brain injury, or they could have poor liver function. So a lot of things to consider. So the take-home point that when it comes to metabolized and free or total cortisol readings is that you really need both markers to make an informed decision about any plan to correct any imbalances, as when a person's total cortisol clearance is not taken into consideration, then the free cortisol measurements alone can definitely be misleading. And I made that mistake in testing people when I first started out, and now I won't even do a straight cortisol test without metabolized. That pretty much covers the hormone side of the Dutch test, but there are also some great extra features that are included called Dutch extras. Now, the extras that Dutch throws in to their panel are what's called organic acids and neurotransmitter metabolites. As organic acids and neurotransmitter metabolites are markers for vitamin and mineral levels. They can show signs of oxidative stress and then low neurotransmitter levels in the body, all of which are highly correlated with numerous chronic illnesses, behavior disorders, hyperactivity, fatigue, and autoimmune conditions. And man, that's a big, long list where it would be great to try to find out why some of those conditions are being caused. As many people with chronic illnesses or those who are imbalanced and have any form of a neurological disorder often excrete abnormal amounts of these organic acids into their urine, and those very markers can light the way to numerous possible healing opportunities. I use an organic acids test for gut toxins, and it can show a whole bunch of information. Now, if abnormalities are detected using organic acids, then treatment options can include certain targeted supplements, such as certain vitamins and antioxidants, and even specific dietary modifications. And what are we doing as a nutrition coach? That's what we're doing. We're trying to improve people's diet through their lives through diet, lifestyle, and nutrition. The first grouping of Dutch extras that are not really organic acids but are more kind of markers are melatonin and the oxidative stress marker 8-OHDG. Now, melatonin is an important hormone that serves as a powerful antioxidant made in the pineal gland in the gut. 8-OHDG is also super important because it shows how high someone's oxidative stress marker is, and if high, that can signify that there may be DNA damage occurring, and you might need to severely up your antioxidant count. Now, the organic acids that are included on the Dutch test or the Dutch test report are something called methylmalonate or MMA. If elevated, it can reflect inadequate levels of vitamin B12, so a vitamin B12 marker. Xanthuronate, if it's high, it can reflect insufficient levels of vitamin B6, so you might need to take something like a P5P. And then pyroglutamate, okay, if this one's low or high, it can indicate insufficient levels of glutathione in the body. And remember, glutathione is super important as it's the body's master antioxidant. So the neurotransmitter metabolites the Dutch test reports are something called homovanillate, okay, HVA. This is a dopamine metabolite and can also reflect genetic mutations and nutritional and deficiencies in other neurotransmitters and even adrenal problems. Dopamine is used for so many things in the body, and if it's low, it can affect 200 to 300 different processes. The next one, VMA for short, this is a norepinephrine metabolite, marker that can reflect genetic mutations in nutrition, again, neurotransmitter problems and adrenal problems. Remember, epinephrine and norepinephrine are what's secreted in the initial seconds of the stress response, and then cortisol comes minutes after that. The last one is called 5-HIAA. I'm not even going to attempt to say that on camera because I'll butcher it. This is a serotonin metabolite. Remember, serotonin is the precursor to melatonin, and it's also that feel-good hormone. This marker can reflect neurotransmitter damage, estrogen problems, inflammation, and again, adrenal problems. Now, an image of how organic acids are measured can be seen right here. By looking at the diagram, it's easy to see that in order for the body to make an important hormone such as epinephrine all the way in the right corner, that it needs to go through several steps, and it needs certain vitamins and minerals that serve as cofactors in order for the body to produce it. And there are also, as you can see, all these little stops and chains. There's numerous possibilities where lots of things can go wrong. And when those things go wrong, the body then spits out these important organic acids, and that is the reason why they are identified and measured. As you can see, before dopamine can be converted into norepinephrine, okay, if we don't have enough copper or vitamin C, what will happen is it will create this organic acid called HVA. That's how the process works in a nutshell. So that's the not so short summary of the Dutch test. I apologize, this video probably went a little over. Try to keep them to 15 minutes. I think this is way over 20. But I hope by watching this, you can see how powerful of a tool that this functional test can be for anyone that's having any type of hormonal problems or for any nutrition coach that's working with clients that have hormonal problems. You need to be a practitioner to order it, but lots of people can order it out there. You can even actually order it online without even a practitioner, but I would highly advise having someone that can read the results for you. So, in closing, if you like this video, please subscribe to the YouTube channel so you can be notified when we create more and when we put them out. And it would be really nice if you can please like and comment below so that these videos can get in front of as many people as possible. Or if you want to rip me for not speaking clearly, go ahead and do that as well. So, Travis James Zipper here with In3 Nutrition and the Nutritional Coaching Institute, signing off. Have a great day, and hopefully I'll see you again soon. Thank you.